Dr. Charlie, I found an exercise that was helping my sciatica, or an exercise program or a treatment, and it was really working, but then it just stopped. It quit working. I've plateaued. What do I do about it? There's a couple ways to handle this. There's a common mistake that people make, and I want to let you in on it. If this is what you're experiencing, maybe you've been doing something and it seemed to get you to a certain point, but it's no longer helping. So again, there's a mistake that people make that I want to help you avoid. And then there's a way that I recommend you think through this. All right, so there's sort of a super ninja way that you can get something that was working but is no longer working to work again, and that's what I want to share with you in this video. So, hey everyone, my name is Dr. Charlie Johnson. I'm a physical therapist. I have my board specialty in orthopedics. I work with people all around the world with back, butt, and sciatica problems with the goal of teaching them how to use their mind and movement as medicine. By the way, if you have something with back, butt, or sciatica problem, go ahead, check out my Better Than an MRI DIY diagnostic guide to determine the most likely source of your symptoms for free. All right, so let's dive into it. So you've plateaued. You were doing a certain treatment or a certain exercise program or motion, whatever you want to call it, and it was helping, but now you feel stuck. What's going on here, and what would I recommend you do about it? Well, before I recommend what I would do about it, one thing I want to let you in on is the most common mistake and or the sort of tendency for people when they have something that's working and it no longer works. Here's the mistake. They look for alternative treatments. All right, so I just had a woman actually who's working with me privately inside my Glute Relief Accelerator program. She's saying, hey, Charlie, the motion that was really helping me, for anybody who knows what I do and how I think, we're a big fan of doing just one motion and finding what that one motion is, because if you're doing a whole sheet of them, well, you're probably not able to identify what's helping or what's not. So this woman said, hey, my one motion that was helping me, it's no longer yielding improvements, right? It's no longer helping me. Again, it's kind of stopped working, or I feel plateaued. And she said she was about to make the mistake. This is why I'm sharing it with you. Don't make this mistake. So I started testing some other motions. And here's the reason why I don't recommend that. If you think of movement as medicine, then each movement could be considered, or each exercise, or each treatment, if you will, could be considered a pill. And if you have a medicine that's helping you, and then all of a sudden it stops helping you, would you just say, meh, that medicine isn't useful anymore? I'm gonna give up on that medicine. Find me a new medicine. Would you do that? Would you go back to your doctor and say, hey, this one's not working anymore? And would they just scrap it even though it was helping you before? And the answer is probably not. What would they do? They would change the prescription, right? So rather than looking for something new, when you already have historical data to suggest that that exercise or that treatment, that input was helping you, don't change it just yet. It helped you, and therefore we might just need to shake things up a little bit and approach things in a slightly different way. So what the doctor, if you will, who prescribes medication might recommend is you change the prescription. This is probably what they would do, right? They would change something about the dose of the medication if it was working and it stopped working. So dose is how much you take. They might change the frequency, how often you take it. Or they might recommend maybe you take it at a different time or something like that. These are the three elements of any pill, if you are any medication. There's a prescription that includes a dose, a frequency, and a time. All right? So you could change the prescription. That's one way, and I'll talk more about what that means specifically here in a moment, of that specific exercise, treatment, or input that was helping you. Before you move on to another one, you could change the prescription, something about the dose, the frequency, and the timing of it. Or if you know that that medication helps, that movement helps, that exercise helps, why not just tweak it slightly? So it's not an entire new class of medications. You're not jumping to an entire new motion or direction of moving your body that's unexplored and has yet to be proven valuable. And instead, you tweak it a little bit. So for example, maybe you're doing a certain stretch with your leg. Let's just call it a hamstring stretch for the sake of the video, all right? And the hamstring stretch was helping, but it no longer is. Again, you could change the prescription, we'll get to that in a second, or what you could do is you could tweak it a little bit. You could change the medicine just ever so slightly, the chemistry of things just a little bit. And what that would look like is instead of doing a traditional hamstring stretch with your leg straight up and pulling it up, you might rotate your leg in when you stretch it. You might rotate your leg out when you stretch it. instead of doing repetitions, instead of doing holds of the hamstring stretch, maybe you've been told by your PT to do 3 30-second holds or 3 45-second holds or something like that. Oh, sir. Why not go ahead and do repetitions? Pull it up and down, lift it up and down, lift it up and down. All right, so let's summarize this and make sure it's super clear. When most people have an input or an exercise program or treatment that's helping and it no longer helps, things sort of plateau. What they generally do is they move on. They look for alternative treatments. They throw away the medicine that was helping and they look for a complete new one. Don't do that, not so fast. Instead, you could change one of two things and start testing further the thing that was helping to see if you just need to change it up a little bit. What could you do? You could change the pill itself just a little bit, change the chemistry of it. So this would be like a tweak to the exercise that you're doing. So again, the hamstring stretch example. If you were doing reps, you could do holds. Or if you were doing holds, you could do reps. So choose between holds or reps potentially. And then maybe change the sort of way that you're doing it in the sense of, again, hamstring stretch, leg rotated in, leg rotated out. Maybe instead of doing something seated, sitting up tall, maybe you slouch and do it, right? And so maybe you just kind of change your body position a little bit while you do it to see if you can get a different result, all right? So it's kind of like step one. See if you can tweak that thing which was working but no longer is just a little bit to see if you can change the input ever so slightly to deliver a different and continued result. The second thing you could do, so number two thing you could do, besides just barking dog, hold on. The second thing besides changing the pill, if you will, ever so slightly, not an entirely new class of medication, just a little bit, we just talked about that, you could change the prescription. If movement is medicine, then you can change the dose, the frequency, and the timing of the medication such that we can potentially get better therapeutic value or effect out of it, meaning we can make it start working again, all right? So the dose would be how much? So let's take the hamstring stretch, for example. Maybe you try tweaking it, you try rotating in, you try rotating out, you try switching from holds to reps, and you're like, meh, doesn't really work. Okay, that's fine. The second thing, now we're gonna change the prescription. Dose. Well, it was working, Charlie, and I was doing 3 30-second holds twice a day. That's what I was told to do, and it was working, but no longer. Okay, what could you do? Well, why not do 3 60-second holds twice a day? You change the dose, how much, but you didn't change the frequency, how often. You're still doing it twice a day. Or we didn't change the frequency, we didn't change the timing, we just isolate changing the dose of that specific pill or motion that you're using as medicine. And you see what happens there. Then we could change the frequency if we wish, right? And these are in no particular order, by the way. I just care that you try to isolate the variable to determine what's helping versus what's not. All right, so frequency, maybe you keep the dose the same. You do 3 30-second holds, you don't change how much. But instead of doing it twice a day, you double the frequency. You do it 4 times a day. And now we see same, better, worse. Your trend was better, better, and better, and you were kind of stuck. You felt plateaued. Something was helping. No longer is helping. I feel stuck. Instead of looking for something new, now we're changing the frequency. We're manipulating the movement prescription. Pretty cool. And then we see what happens there. And let's just say that doesn't do anything. We can change the timing. Well, what do I mean by that? Well, instead of doing an exercise, this guy's going very fast. It's not a guy, it's a gal. Instead of doing the exercise maybe in the morning and then maybe again at night, maybe we do it midday and we see what happens there. Or instead of doing the exercise when you get home at night, you do it for a couple rounds in the morning, or vice versa. Or why don't you just do the movement or the exercise if you see it as medicine? When would you take your medication? You take your medication when you need it most. So if your symptoms are worse in the afternoon, maybe right now you've just been doing the exercises whenever you can fit them in. But does that really make sense? Wouldn't it make more sense to do things, if you get symptoms around 4 or 5 o'clock, do some exercise at 2 and then at 3:30. Or if you have trouble sleeping, do exercise right before you go to bed, right? And so again, I think if you can shift the way that you view exercise, we're not just trying to get in shape here, we're trying to get out of pain. If you take pain pills from a place of understanding that, hey, probably don't want to take more than necessary, I want to take as little as needed to avoid interactions or reactions to the medication. And if I'm taking a bunch of pills at once, I'm probably not going to know what's working. So why wouldn't I think of movement if I'm trying to reduce pain, just like a pill is trying to reduce pain? Why wouldn't I think of movement as medicine? How could I apply that concept and see each motion or each treatment input as a pill? And to summarize, if a pill is no longer helping, but it was, and it got you to where you are now, to where you're feeling a little bit better, rather than just tossing it, throwing it out and saying, hey, I need something new, change the prescription, right? That's one option. Or change the medication just a little bit. What's a very similar pill? Might be the same motion base pill, but maybe you rotate how your legs are, in or out. Maybe you change the speed at which you do it. Maybe you change it from reps to holds or holds to reps. And then again, you've got the prescription, the dose, the frequency, and the timing. Double up on the frequency. Do it twice as much, twice as often throughout the day. Double up on the dose, or maybe lay off the dose. You know the best way to determine if something's valuable or not? Let it go. And just like that old love quote goes, if someone loves you and you let them go, and it was meant to be, then they'll come back to you. Something like that. All right, so if you let that specific intervention or treatment or exercise or motion go, and you drop it out completely, no prescription, for a day, 2 days, 3 days, just kind of reset, well then, it's gonna tell you something. If the motion was as valuable as you think it was, then symptoms might feel a little bit worse, right? Because it was helping you. If you drop it out and you feel better, then maybe that motion got you to a certain point, but it's possible that it was actually holding you back. Maybe you're doing it too much. Maybe the prescription was too high. And so how do you create contrast in your results so you can better understand the impact of specific variables on your back, butt, or sciatica symptoms? Go to the extremes. Double the dose or do nothing at all, right? You can kind of play with these pills, if you will. If your symptoms don't change at all after dropping out a specific pill or movement that you're using as medicine, you're not doing that thing anymore, you're not taking the pill, but your symptoms are no better or no worse, then how much value is that bringing to your healing? Probably not much, because without it, you do just as well. And so you can see how we can sort of apply these concepts. We can cross-pollinate these concepts between medicine, right, and movement. Movement is medicine. And we can start to really scientifically break this down for people, all right? So again, I wanted to share this with you. If you're watching this video, you felt like there was some hope because you were doing something, some treatment, some exercise. By the way, I recommend you try to find the one thing that you need to do motion-wise or input-wise on the exercise side of things. Because again, if you're mixing all kinds of exercises or motions or pills, then they can sort of counteract each other and you don't know what's working, what's not working. But at the end of the day, the goal is to be scientific. If you're trying things and it was working, but it no longer is, instead of just tossing things out, go back, manipulate what that pill might look like slightly, and or change the prescription, right? And oftentimes what you'll see is that you'll be able to get something that was working, you know it was working, and you'll be able to squeeze some more juice out of it, all right, and get you to the next level, break that plateau, and get you closer to living a pain-free life. All right, so this is Dr. Charlie PT. Hopefully this was helpful. Let me know your thoughts below in the comments. And I know I used the hamstring stretch example, but apply this to anything. The trunk twist, the figure four, the back bend, the forward bend, the knee to chest, any exercise or treatment you're doing, the same concept. These concepts are universal. I challenge you to apply them to your own unique situation. And let me know in the comments, was this helpful? Was this not helpful? And if you're interested in taking a very scientific and methodical and systematic approach, a very process-oriented approach to solving this, your back, butt, or sciatic issue, and you feel like that's what's been lacking because you go somewhere and they give you a sheet of random things and you start one day with this and the next day you go and it's something different and you don't see the same person every time, and you're like, hey man, I wonder if I could actually be taught or learn how to solve this in a very systematic way, go ahead. We work with people all around the world with back, butt, sciatica issues, so I'd love nothing more than to review your case to see if we can help. Click the link below. It'll take you to a time to chat with us, so a schedule page, then follow instructions to submit your case. I will review it personally and let you know what that might look like. Thanks so much, everyone. Chat soon.